Alright, this is my actual first run through. I will try to make this as smooth and easily and understandable as possible. Please forgive me for any of my shortfalls if I show any. Alright, so the first things you do, alright, here we go.
Come in.
Hello, my name's Matt. I'm your student nurse today. I want to perform a head-to-toe assessment, if that's okay with you.
Sure.
Alright, can I see your, let me wash my hands. I'm going to pull the curtain for privacy. Alright, can I go ahead and see your wristband? Can you tell me your name?
Gwendolyn McMillan,
Alright, can you verify your date of birth?
7/12/80.
Okay. Also, can you tell me where you are today?
I'm in Gecko Hospital.
Alright, do you know what today's date is?
2/27/2013.
And do you know who the president is?
Obama.
Okay. Can you go ahead and sit up on the side of the bed for me?
Sure.
Okay. At this time, I've already assessed her Glasgow Coma Scale, her level of consciousness, and now I'm going to go ahead and check cranial nerves, perla, and everything that has to do with the head. Alright, so I got my pen light here. Now what I want you to do is look at the end of the pen and follow it with just your eyes, not your head. Okay? Always remember to return to the center. And this is the cardinal gazes, assessing cranial nerves. Also, since I do have my pen light, I'm going to assess her eyes. The sclera should be nice and white. The conjunctiva should be nice, moist, and pink. Alright, so go ahead and can you pull down your eyelids for me? Alright, nice. Okay. Also, I want you to go ahead and look straight ahead. And I'm going to bring them, bless you. I'm going to bring in the pen light and watch her eyes for constriction, dilation, or constriction. Alright, now I want you to go ahead and focus on the wall behind me. Pick a spot, any spot. Okay. Now focus on my pen. Okay. So that now I can say that her pupils are nice. Pupils are equal, round, reactive to light, and accommodated. So she is perla. She has perla. Alright. Now I'm going to go ahead and take my hands. I'm going to feel through your head. And what I'm going to be looking for is symmetry. I'm also going to be looking for any abnormalities. Also checking the hair for distribution and texture. Okay. Since I'm up here, I can go ahead and assess the temporal arteries and the carotid arteries one at a time. Alright, now if you can, I want you to go ahead and plug one nose and breathe out, and the other nose. Okay? I'm going to look at her ears on the exterior, and I'm also going to perform a whisper test. Okay? Okay. Now I'm going to go ahead and assess your mouth. So if you can, go ahead and open your mouth, stick out your tongue, say ah. Okay, now I got my pen light. I'm going to, while her mouth is open, I'm going to look at her mucous membranes. Okay, lift your tongue. Okay. Also, I can check her gag reflex at this time using a tongue blade. Stick out your tongue, touch the tongue, gag. Okay, she has gag reflex, which is cranial nerves 9 and 10. Alright, also at this time, I'm going to be assessing skin throughout the whole assessment. looking for any distinguishing marks, tattoos, acne, scars, etc. Alright. Now, I'm going to see, I want you to go ahead and I want you to copy what I do with your arms, okay? I want you to raise it up and down, okay? Forward, turn, back to your side. And the same, up, down, forward, and then back to your side. So range of motion. Also, I want you to go ahead and, well actually, hold on. Yes. I want you to go ahead, cross your fingers, hold up your hands, cross your fingers, okay? Wait, hold on. I want you to grab my fingers and squeeze as hard as you can. Okay? Now I want you to go ahead and push towards me. Okay, now resist me. Okay. So I just checked grips, push and pulls on the upper extremities. Also, while you have your hands here, I want you to go ahead and touch your fingers. Coordination. Okay? And your strength, I would say, is a 5. Also, while I'm up on the upper extremities, I can check brachial pulses, radial pulses. I can look at the nails for any clubbing, color, capillary refill for circulation and vascular. Also skin, which is appropriate to ethnicity, temperature, which is appropriate to
warm and dry.
right. So situation, or could
Yeah.
you say? Okay. And also, at this point, I can do my 2-point discrimination. Go ahead and close your eyes. Tell me if it's sharp or dull.
Sharp. Dull. Sharp. Dull.
Now is that on both sides, right? Okay.
Dull. Dull. Sharp. Sharp. Matt.
Oh,
And
yeah. And also, let's say capillary refill. But also on the other for skin would be turgor to see if there's any tenting. I can also do it up here as well by the neck. At this time, I'm going to go ahead and okay. I'm going to go ahead and access the. I'm going to look at her lungs since you're sitting up. She's not breathing with the use of accessory muscles. Her rate is 18, which is within normal limits, and she seems to be breathing at a steady rate, at a steady rhythm. I'm going to go ahead and listen to your lung sounds, okay? So I can start at the top in the back. So I'd listen from one side, breathe in. Every time you feel the stethoscope touch you, go ahead and take a deep breath. Okay. I'm listening for your lung sounds are clear. No abnormalities noted. Also, she has a 2-to-1 AP rate, 2-to-1 ratio, AP ratio, and symmetrical. So her anterior and posterior thorax is symmetrical. Also, I'm going to move around to the back of the bed. As you feel my hands move, I want you to say 99. Go ahead, say 99.
99. 99. 99. 99.
Okay. Now I want you to go ahead at the I want you to go ahead and take a deep breath in. Checking for a thoracic expansion, which is normal. All right. So I've done that. Also, I want you to go ahead and I'm going to listen to the front. So. To the sides. Here I'm listening to vestibular, vesticular, bronchovesticular, and bronchial lung sounds. All right. Since you're sitting up, I'm going to go ahead and listen to your heart. Okay, you don't need to breathe for this. Well, breathe in every time. You can just go ahead and breathe normally for me, okay?
Okay.
So A, P, T, E, and M. M is S1, A for aortic is S2. Alright, now I'm going to go ahead and have you lay down on the bed for me. Alright, I'm going to go ahead and inspect her abdomen. Her abdomen is not bulging, it's symmetrical. And I'm going to go ahead and listen to all four quadrants, starting at the right lower quadrant. Listening for active vowel sounds. 15 seconds in each quadrant. Unless no vowel sounds are heard, then it would be 1 minute in each quadrant. Alright, so I have active vowel sounds in all four quadrants. I'm next going to go ahead and lightly palpate to feel. Let me know if you feel any tenderness or pain. Alright, abdomen is soft. Okay? Alright. Now I'm going to go ahead, and since I'm here, I can go ahead and move down the body, assessing the femoral arteries, temperature, popliteal arteries, skin for I can just check for turgor, edema, dorsalis pedis.
That's
Right?
the
No, sorry.
That's this one, the top.
Yeah, this is the
Posterior tibialis.
posterior tibialis pulses on both sides, so you check both sides. Okay, shoes would be off. Temperature, turgor, edema, no edema present. Move to the nail beds, check for color, capillary refill. I can do pulls, push and pull, so I want you to push. Okay, now pull towards you. Okay, strength is good. Now range of motion. I want you to go ahead and bring your knee up to your chest. Okay, straight out to your side, and across. Okay, now bring your ankles in. Or sorry, up. Bring your ankle in, eversion, exversion, right? Yeah, okay. And then I'll do the same on the other side. Up, out, side, across, okay? In and out with the ankle. Okay. And at this time, I can go ahead and have you stand back up or sit on the side of the bed for me.
You didn't do this close.
Oh,